Yeah.
So that really.
All right, good morning. Today is April 2nd, 2024. Time is 9 a.m. Good people roll call.
Geiger,
Yes.
Hughes,
Yes.
Whitlow,
Here.
Hudak,
Yes. Everybody's had a chance to look at the agenda. If I can motion.
I make that
Motion
motion.
makes first, Jen makes second. All in favor, say aye.
Aye.
All opposed, same sign. Motion passes. We've got the claims in front of us. Questions on the claims?
Well, you got some of my paper, I guess, but I forget now.
Where do you want to start? Want to start?
No, I think, well, I'm thinking, now I'm confused on which meeting they're on.
This is health,
I know that's what we're talking about today.
so,
there aren't very many, just that I'm not
look
Okay, then
at
that must come on the other one.
and
But we had that area wide one in there.
yeah, that's all we got. Question on area wide, why it's not being paid here. You go ahead and explain.
Sure. Let's see, late December 23, I believe, the area-wide rep reached out to Jill. Letting know there was a large, over a year span worth of invoices to the health department that had not been paid for a specific service. That specific service being secure messaging and remote access. And Jill was kind enough to forward that over to me. Since then, I've been in conversation with the area-wide rep trying to figure out what happened here. These invoices were monthly invoices spanning from October 2022 through December 2023. We were trying to figure out, this is the first week of these invoices, now know the few charges we were incurring. And since we received this large group of invoices, we have paid the monthly invoices. And I did go back in our previous invoices before this period, I have found evidence that we have paid like invoices since. So it looks like a charge that, okay, we were being assessed, I just didn't know about. But I've been trying to work with the area-wide rep on why we weren't receiving invoices. We checked the email, the inboxes for everyone that's would have received the invoices that's currently here, and for everyone that would have received them that is not working here anymore. I haven't found a trail of where those invoices are being sent. So, been trying to communicate with everyone about this, however, when asked where were these invoices sent, I was told they were sent to this person, so I can check that person's inbox, I can't find them. Because I was incurring these charges, I didn't even know they existed. Now, we're being charged for accounts that weren't even active because those employees were no longer here. Employees that have left over a year worth of time. So I asked if they could adjust it, and I just received back that if you don't pay this, we're stopping your accounts. So I made out a claim. My Board of Health Finance Committee is going to look at it tomorrow. Been trying to work with everybody, trying to figure out what happened here. Like I said, we've been paying the invoices that we received since. Just trying to figure out why we never received these invoices for over a year span, and expect to pay them now. It definitely looks like charges that we should pay, but there's also a lot of charges here that if I knew we were incurring, I would have deactivated for secure messaging and remote access accounts for people that haven't been employed. So that's the story on that.
How have you been getting the most recent invoices that you were paying? They come to your email address?
Now they're coming to my email address.
Muddy water.
So the next question is, are you gonna lose service before it gets paid?
No.
They have threatened.
I talked to Bernie and let him know that the claims are made out and they're gonna go before the Board of Health this week and that checks will be cut next week. I also explained to Tina, which she said she had talked to you, Eric, that we have gotten special permission before from the chairman, to pay bills right away. And that may be something that he should do, is talk to Dr. Zumwalt and see if they can get permission to pay them right away, so that their service wouldn't have been in jeopardy. And the claims got brought down to my office last Thursday, so we could have cut checks on Thursday and gotten those paid if Dr. Zumwalt was okay with that.
I don't think that through my Board of Health setup, I don't think we have the ability to assign claims like that, even with Dr. Zumwalt's.
We don't get them signed by John until, we see him in person, but we have the authority to call him and get special permission.
Yes, I don't think that I have that flexibility. Unfortunately. Good Board of Health.
Did you ask?
No, I haven't myself.
I would ask, just for future reference.
So what account does that come out of then?
That's all health.
That's all health department.
But you write the check for it.
All health department claims.
We write all the checks for everybody.
After they get approved by the Board of Health, and then
We get one every month.
they all go through the finance office, so. But this will come out of health department funds.
Okay, so I have another question. So we have quite a few department heads.
Mhm.
How do we resolve this situation so in the future, who else is made well aware of what's going on with
So the
some of
way
these
area-
bigger bills?
The way area-wide works is, departments have their own board, like health department, 911, they receive their own bills. For special services that they have requested. All the other bills come through to Amanda. And I inherited the policy, so I've kept the policy because I think it's a good one. If there is any department that goes outside of requesting IT services, not through my office, then they are responsible for paying their own area-wide bills. And then, the county will pay for those that, like Adam's weekly visit, we pay for those, and everything should be pretty much resolved there unless it's an emergency situation. And a lot of those emergency situations, to give you an example, right before the election, Brian had a printer issue, and she paid for that out of her automation. So, that's the policy inherited, I think it's a good policy, that's what we go by. I just had an issue this morning with somebody who did not go through the proper channels. And, we received a bill because they made a phone call to area wide. And Amanda sent it over to him and he sent it back and said, this is a county problem. And I gracefully sent it back to him and said, I'm sorry, but for the policy we have, you called them without alerting Amanda or myself. And therefore, the bill is your responsibility. I haven't gotten a response yet, so we'll see what that concurs, but.
I think I understood Eric today that in these delinquent bills, there's some question on who they were targeting the charge to by doing security on.
It was requested by the health department when Dee Shipper was the administrator,
Uh-huh.
so therefore, those bills were sent, we never saw those bills, they go directly to the health department.
My question is, do you see where sometimes area-wide ends up charging ghost charges or for people who have moved on or?
No, because it is the department head's responsibility to alert them if they have a change of employees and they need emails deactivated.
This started in October 22, you're saying?
Yeah.
I don't know.
So like I explained to Eric, with all the hubbub, the area-wide bills, as long as everything else that we send go to, the health administrator and and the financial officer and their assistant. So 3 people get included on all emails. And what I explained to Eric was, somewhere along the line, through the whole Dee and you and Tina, and they've had quite a bit of changeover in that office. I'm not sure what happened. I understand that he did a search or had Area-wide do a search and they couldn't find the emails. I can't speak on that behalf, but mark it up to, this is something that happened, let's get them paid, or your other option is to find your own IT provider.
From what you've seen of those bills, they seem to be accurate.
They're for secure messaging that were requested by D. Shepherd, who was prior to Eric.
I think that we are definitely responsible for up to 90% of what's being charged and assessed of us. And to Area Wide's defense, even though I'm not happy with them, they could be assigning late fees and they're not. My big problem is that I didn't know these charges were incurred because we haven't received a bill for this since I've been administrator. And so I couldn't tell them, hey, this person is not hearing me. So I asked the bills to be adjusted and I gave when certain employees left, and the answer was, if you don't pay these, then we're not gonna. So I've made out the claim and my board's gonna look at it tomorrow.
So is that the claim that's in our packet then, Amanda? Is that for the $1,700?
Yeah.
I think so. I have not seen it, I didn't know what we mapped, but if that's
I can't
what it is.
So go ahead, I know where you're going.
Yeah,
Well,
it
I'm
was,
just saying that I'm not,
it's $1,192
Right.
and that catches up the arrears of the health department, you're saying?
for 16 past due invoices.
But for the good of the whole county, we probably need to take care of them because they do
Yes.
provide us services.
Well, it doesn't affect the county, because we're all paid up to date, whatever, we're good, we're in good standing.
They're only
But-
threatening to cut off secure messaging and remote access for the whole.
Right.
Well, but
Right.
still, in principle, I mean,
We gotta have the other departments in the future, is what you're saying.
well, no, I just, yeah, exactly. I just wanted to have a good taste in everybody's, mouths. And I respect what you're coming from too, saying I don't know about all this stuff, but it's kind of water over the dam, under the bridge, kind of.
Good.
You're gonna still do some checking, we're gonna
Well,
settle up.
I've done my best to do some checking, Area Wide's done the conversation, and I don't have too many legs to stand on the subject, so. Claim's been made, my board has to approve it.
Any other questions on the claims? So we're good now.
Yeah.
Can I get a motion to approve the claims? Steve?
I was like,
Don? Are we ready?
Dugat,
Yes.
Geiger,
yes,
Pierce,
Yes.
Whittle,
Yes.
All right, public comments for the health department? All right, move on to animal control, Jill?
Yeah, so the total deposit was $7,765. We collected some fines and fees, and, registration due notices went out, so I always see an influx in deposit. We have 6 cases currently open. I have 4 bite reports and, 2 dogs that are waiting to get placed. This is when I did this yesterday, we picked up 2 more last night. I'm hoping they get claimed though, because they have collars and tags and all that, so fingers crossed. The officers closed 29 cases last month. There were 3 relinquished, 9 dogs running loose, 5 bite reports closed. One of those bite reports was a rabbit, so we didn't obviously do anything with it. I'm not gonna sound on a rabbit hunt. One was, left in a rental unit that we had to pick up. We had 3 injured, 3 well checks, 3 nuisance calls. We had a cat hoarder situation. They had over 50 cats in their house. We got, one of our rescues we work with to help us out with that one, so we don't have any of those cats.
Okay.
We just paid for, the officers to go get them out. And then we had 1 cat in a ceiling call, so they got that one out and, it right away got to go to, rescue, so we're good.
Eric, you're up.
Okay. Program summary report. Before I get into this, or I forget to mention, this past month, we had our initial meeting for the I-plan that we were doing. It's a good first meeting, get to underneath it now, so I was pretty happy about that. And we have a number of subcommittees already scheduled for that. The intention here is to have subcommittee meetings for the next 2 or 3 months, and then bring the full committee back once to twice to put the final parts of all the plan together. We'll be doing public surveys and partner surveys, and doing a lot of data-driven analysis to try to figure out exactly what we need to prioritize the county's health goals in the next 5 years. So that's one large project we're working on. Program summary report, environmental on the front page. Let's see, trying to just highlight the big things. Getting active on wells and septics again as the weather is warming up. We did one initial lead inspection, that was just last week. So,
What triggered that you did a lead inspection?
when a child has an elevated blood lead level of 5 or above, and so often this occurs in children under the age of 5, and usually it's because of deteriorating lead-based paint in the home.
And it's found in the child by, they don't feel good, they go to the doctor, they run labs and they find lead, or?
Usually these blood lead screenings are routine for children in that age range.
Really?
Usually happens with just a finger prick, and that is a capillary test. If the capillary test shows high, then they're followed with venous draw, which is more accurate data. And if that shows an elevated blood lead level of 5 or more, then we go out. So the level used to be 10 back in like 2017 or 2018, and it's lower than 5. And there's currently talk in state legislature to even lower it to possibly 3.5 or so on and so forth. So as the regulatory level for blood lead in Illinois goes down even more, we're going to be called out to more and more cases. One of the reasons why just this year, right now I was the only licensed lead risk assessor in the health department. We just added one more. Kate Miller passed her lead license test in January, and I got one more ready to take another test. We're in the progress of adding more staff to that particular program. Page 2. Bump in childhood immunizations. And animal bites, we had 3 animal bites, 1 dog, 2 cats. None of these bites resulted in pet treatment, which is good news. Let's see. We had one COVID-19 outbreak that was at a congregate living center within Iroquois County, Bullfleet. There was only two people in that outbreak. That's all it takes to be an outbreak at a congregate living center too, and their staff. The hepatitis B case was confirmed, but the source was unknown. And the hepatitis C case turned out to not be a case, it was just an investigation. There was an influenza-like illness outbreak at a long-term care facility within Iroquois County, and included 13 staff and residents, all tested positive. That's probably the highlights from that page, just if anybody has any questions. Tuberculosis. We had 1 possible latent TB case. That's the new case investigated. We did 15 Narcan trainings. We gave out a lot more than 15 Narcan kits for those 15 Narcan trainings. We did a number of these at Milford Public School District when they had a parents' night. We went and gave a presentation with our hidden in plain sight display, and with that we're able to orient giving out a lot of Narcan. We also gave presentations at Iroquois West School District and Watsika School District, where we have nurses and medical. We gave out a few in the office as well.
Those Narcans have expiration dates on, about how long roughly?
Sometimes a year or 2. And if you ever get free Narcan from us and it expires, you can call and make an appointment. Back, we'll get rid of it and we'll give you new Narcan. 2 CPR trainings. We did those for 911 actually. Breast and cervical, numbers are a little up, which is good news. However, we are a sub-grantee of Livingston County Health Department for Breast and Cervical Cancer Program. And we've been sub-grantee for them since 2014. Unfortunately, they are going to drop the program as of June 30th, so we have to make some decisions on whether or not we're going to be carrying on this program. Don't know all the ins and outs yet. I'm still waiting on a call back from somebody at the state about it, but I just want to give you all a heads up. It's a new program that we've been happy to highlight in the past, because when it does get utilized, really good work gets out of it. Women that are underinsured or uninsured are able to go and get these cancer screenings and basically for free. If we drop the program, it would be certainly a problem. We're not quite sure if we can maintain hosting the program ourselves. So, heads up on that. Any questions on page 3 to the last page, page 4? Vision hearing screenings, 7777. We'll probably be wrapping that up in April and May. Senior services, we're down on total clients on services, down from 187 to 177, which is good. It's a bit more manageable. We've been operating pretty high by quite a while. We got up to 200, so this is good news. And that's pretty much my program summary. If anybody has any questions. Thank you.
Any old business? Any new business? Make it a motion. Make it a second. All in favor, say aye. Aye. Adjourns. Time is 9:25.